Welcome back, my friends, to the D-Rate the Hate podcast. I am your host, Wilk of WilksWorld.com, and I am so incredibly grateful that you are taking the time to join me for another powerful DTH episode. Friends, at the D-Rate the Hate podcast, it's all about bettering the world one attitude at a time. See, we did not create the hate, but with your help, we can derate the hate. That all starts with gratitude and personal accountability. We cannot control everything that happens to us in life, but we can control how we react to it. How we act, how we react, no matter what happens to us, how we react to it makes the difference. Friends, there is only one good thing about a bad attitude, and that is that we have the ability as individuals to change it. Here on the DTH podcast, we strive to bring you great guests and provide tools to do just that. Please be sure to share it with your friends. Subscribe if you haven't done so. Ratings and feedback are always greatly appreciated. And with that, let's get to this week's episode. Friends, welcome back for part 2 of my incredible conversation with Dr. Francis Collins, former director of the National Institutes of Health. I hope you found as much value in part 1 of my conversation about the Truth and Trust Project with Dr. Francis Collins as I did. Every time I get a chance to talk to Francis, I am just so impressed with his candor, humility, and willingness to talk about this subject that has become so contentious for so many. While Francis and I disagree vehemently on much of the government's response to the pandemic, we are able to discuss this in a civil and responsible way, the way that it should be done, as opposed to the way that it's done so often between politicians and those in our media. If you did not catch part 1 of this conversation, I would encourage you step back and listen to episode 119, where we talk about how we met, how the Truth and Trust Project started, the origin of the virus, the initial thoughts, the initial actions of our public health officials and government officials. And then here in episode 120, I'm going to continue the conversation a couple minutes from where we ended part 1, just so there's context. But in episode 2, you can expect getting children vaccinated, the doctor-patient relationship, government mandates and where those came from, what freedom really means to so many people, and what casualties of a free society are, and how that contrasts with government mandates and employer mandates when it comes to, say, the military and healthcare workers, and so much more. So don't miss this incredible conversation, part 2 of my conversation on the Truth and Trust Project with my friend, Dr. Francis Collins. Here we go.
Somewhere along the line, people got the idea that people who were promoting vaccines were basically ignoring a natural infection like it didn't matter. And that was never correct. And if any of us made it sound that way, then we were wrong. But it doesn't mean that it's sufficient. It's a good way to raise your antibodies, although it puts your life at risk. But if you really want to raise your antibodies, want to protect yourself and your family and all those people you're around that you might infect, well, do both. It doesn't have to be either or. It can be both and.
Mm-hmm. Okay, so yeah, I mean, obviously, especially with the news. Now, we're recording this on July 21st, 2022. So the news that came out today, most people will have received the news by the time they listen to this. And the news that came out today was President Biden today was diagnosed with COVID-19. Thankfully, he's probably got one of the much weaker but more contagious variants like the BA4, BA5 variants. But there's going to be people in our media, in social media, that are going to use this and say, I'm not even going to say that I disagree with them, because I probably don't. But okay, so President Biden is double vaxxed, double boosted, and still contracted the COVID-19 virus. I've had COVID-19. And this is probably I know this is the first time I've probably said this publicly, I've actually had the vaccine. Not going to get into that much, but probably wouldn't do it again. But either way, doesn't matter. So President Biden, bless him. Hopefully, I wish him well for sure, even though, like I said, There's probably not a decision he's made in his entire life that I would agree with, but bless him. God bless him. I hope he does well. I hope he comes through the virus well, and we're all going to hope for that. But there will be people in our media, and there will be people on social media that use the fact that he's been double vaccinated, double boosted. He wears a mask in most social settings, things like that, still contracted the virus. So what do you say to that? I mean, it happens, obviously, right?
That's a great question. And again, I think what we have to decide is what is the goal that we're trying to achieve with vaccines? Is it to keep people from getting infected, like the president now is? Ideally, yes. But is it really to keep people from dying? That would be the top-notch goal. The vaccines, I had wished at the beginning would be so amazing that once you were vaccinated, you couldn't get infected at all. That it would be like the measles vaccine, which is like 100%. If you've had that vaccine for life, you're protected. But it turns out this coronavirus is wily. And because it keeps changing from the original to deltas and betas and now Omicrons and BA5s, the immunity you got from the vaccine is not quite good enough to keep you from getting infected, but it's good enough to keep you out of the hospital and out of the ICU and out of the graveyard.
It has done incredible things. I mean, there's no way to deny it for a portion of the population and people that are really at risk, like the president, heart conditions, 78, 79 years old, whatever he is, people that were really subject to the ICU and the hospitalization and the deaths and stuff like that. It's done wonderful things. And I think people discount that, but even going back a year ago today, from the day of this recording, President Biden had it wrong in his public messaging when he said, if you get the vaccine, you will not get the virus. And there was a lot of people a year ago saying that. And I think that goes back to what we said earlier, Francis, was when the media runs that kind of thing on a loop, people really, that's all they hear, and they tune out everything else. Yeah. And then, so they've heard, now you cannot get the virus if you've been vaccinated. But then their neighbor who's been vaccinated and who's been bugging them every week to find out if you've been vaccinated, now all of a sudden he gets the virus. Now they've got ammunition. Now they're not going to get the vaccine because their neighbor who's been bugging them about the vaccine just got the virus.
Yeah. I hope people will stop when they kind of draw that conclusion and go, now, wait a minute. They got the virus, but how are they doing? Is this somebody who I'm going to worry about having to send flowers to their funeral? Or is this somebody who's going to be sick for 3 or 4 days? Big difference there. The data, again, the evidence, because we got lots of this data on hundreds of thousands of people now, is while the vaccines don't protect you from catching the virus, they protect you 90% from ending up sick enough to really worry about whether you're going to live or not. So, okay, that may be kind of the reality that we didn't see coming. It was just about a year ago that I think we began to realize that vaccinated people could still get infected. And it's gotten worse since then because of Omicron and BA5 even more so. That's the reality. It's not the reality I would have hoped for. It isn't necessarily what anybody would have predicted based on other viruses and other vaccines, but it's where we are. And it still says, if you want to protect yourself, your family, if you want to be concerned about neighbors around you, you're better off to be vaccinated and boosted than not, considerably so. And I hope we don't lose that in what has turned out to be a complicated and very divisive situation.
It has turned out to be a very divisive situation. And I think some of that is unneeded. But I also think from a certain perspective, people look at it and they look at the push that certain people are trying to do to get young children vaccinated and people. And the reality is, and statistically, I mean, while there's certainly exceptions, the virus hasn't done much to children in the way of damaging things. And when it comes to our children, my wife and I just had this discussion. We don't think twice now, when our daughter was born and whatever, and raising our kids, the vaccinations that have been around for certain things, like you mentioned, the measles vaccination, So measles, mumps, rubella, you just do it. It's part of everyday life. Americans do it. They don't even think anything about it. The polio vaccine for years, obviously the polio vaccine started out with a number of let's say it started out with a very troubled past, but it was a very big thing. It was a huge accomplishment on the part of our government to develop the polio vaccine and save millions of lives, and the torture of the polio virus for what it did to people. I mean, so we don't even think twice about those kind of vaccinations. But when I look at what happened to me on the second shot, okay, or I look at the statistics when it comes to children and children's reaction to the actual virus and things like that, I'm not a doctor, but I look at it and say that's an unnecessary medical procedure to get my children vaccinated for something that, they've got a very, very, very minute, like almost statistically insignificant chance of anything happening. And I'm not looking for you to convince me here, and I'm not trying to convince anybody else on that either. I mean, that's for people themselves, and this is kind of what I wanted to get into with that. That, in my opinion, is something that parents and their individual physician should discuss together and make those decisions. But where we got sideways, not only in the original messaging, but that relationship between the individual physician and the patient for the first time in American history really got muddled up with this. So talk a little bit about that and people's reaction to, I mean, what happened with the doctor-patient relationship here for what may have been the first time in American history.
Yeah. Well, it got really complicated in a hurry, that's for sure. When you have the worst pandemic in more than a century and everybody's trying to figure out what the heck are we going to do to save lives as people are dying around us, then the public health system kind of kicks into gear and tries to look at all the data and make recommendations, maybe without having appropriate time to consult with the nation's physicians to say, are you on board with this? Most of them are. I mean, I'm a physician. Most physicians look at recommendations from CDC as pretty reliable, maybe not quite all the time, but most of the time pretty reliable. And so in a crisis like this, I think most physicians were willing to go along, although they probably wish they had been a little bit more at the table as those decisions were being made. I think that's probably still true. I mean, certainly childhood vaccination, I would say, the American Association of Pediatrics, which represents pediatricians, is strongly in favor of childhood vaccination. And they weren't just pushed into that by FDA and CDC. Wilk, it's one of those things where you're balancing the risks of two unlikely events, trying to decide which one is more unlikely or more likely. One of them is, what's the risk that this child is going to get COVID and be one of those who does get really sick? And we've lost 700 kids who've died of COVID, so it's not zero. And then the other risk is, what's the chance this is a child who's going to get the vaccine and have a really bad reaction that's going to be harmful, maybe not just even in the short term, but longer than that. And that's clearly a very low risk, but okay, you can't quite say what it is because the numbers that were used in the trials were thousands and not millions. And so every parent and every pediatrician is kind of looking at this. I will say the experts, and these are not government employees, who do the advising of this sort of thing for FDA and CDC, they're mostly doctors. They're mostly people with a lot of experience in infectious disease. They all said they would recommend that people should look at it and the evidence would support doing it, but every parent has to decide.
Yeah. And I think that's what parents want to hear is, look, it's not up to the government to decide what you're going to do with your kids. And that's not just the medical thing right now. That's with everything. I mean, with the complete nightmare that our public education system has become and medicine and, what our children are being taught and how the internet, that was almost a Freudian slip, but the internet and just society now and the stuff that's being forced upon them to rob them of their innocence. There's a whole lot of things going on with parents in the age that we live in right now, Francis. Yep. And this is just one more of them. Yep. When the government is saying, we're going to force all this down their throat but we're also going to force you to inject something in your child that you may or may not want. And I think, and this is just my personal opinion, but I think that is a bridge too far for a lot of people. It's certainly a bridge too far for me and my wife and our family.
Hope it doesn't come across as forcing, Wilk. I think it's encouraging and still saying, it's up to you and your physician to figure this out. On the other hand, I would say if the government said, no, you can't have access to this, and there were parents who really felt that their children needed it, that would be wrong too.
Yeah. And like I said, I think this is one of those things where you solidly need to have that relationship with your family doctor. Yep. And if you are truly in a trustful and a trusting relationship with your family doctor, they will decide. Because I will tell you this, every time that my doctor, and I've had my same doctor for several years, he's not even a doctor, he's a physician's assistant, but he's a fantastic guy. And I trust him, Mm-hmm. So if he tells me something, if he tells me that I need a shot, or if he tells me that he wants me to try a certain blood pressure medication, while I'm not a big fan or not a fan at all of blood pressure medication or taking pills in general, you know what? I trust him. I trust that relationship that him and I have, and I am probably going to do what he is suggesting. We got really muddled up during this pandemic with mandates and what the government was telling people they had to do. And now all of a sudden, because of what the government was saying, certain employers started forcing things upon people. And, I talk about mandates a lot. And one of the things that I like to say is don't make mandates, make better arguments, and if the argument was good enough, most logical people and the people that they trust would have all been on board with it.
Amen.
And in a lot of cases that's not the case.
How do you deal with the fact that, okay, the logical arguments were good enough, but there was all this noise coming from social media and cable news and politicians that was basically trying to blow it out of the landscape. And so the logical arguments were lost.
Yeah. And that's always going to be a casualty of a free society. I mean, I hate to say it, but it really is. When it comes down to living in a free society that is built upon personal accountability and people's right to choose what they are going to do, with their body, with their lives, there are always going to be casualties. And those are things that, we have to answer for. Maybe not in this life, but maybe in the next one, that's just the way that it goes. And I think that is everything in life is going to have casualties. Sometimes the casualties of freedom can be pretty brutal, but nonetheless, it's the best system on the planet. So we're talking about mandates a little bit. And I think when I start thinking about mandates, I start thinking about employers, and I've had a number of conversations with great people in the medical profession and people who have actually chose to walk away from the medical profession rather than have the vaccine or get the vaccine, because they've, for whatever reason, the data that they looked at made them choose not to do it. And we've had good people lose, especially and we're talking about healthcare. So we've had many good people in the healthcare profession either fired or walked away from the profession because they refused to take the vaccine. We've also had people in our military. Our military was mandated by President Biden to get the vaccine. And many soldiers, sailors, airmen, and guard members and things have now lost their jobs, not lost their jobs, but actually kicked out of the military because they refused the vaccine. Now, I would contend that when you're losing your frontline workers in the healthcare profession and you're losing your frontline military members, we are not making our country safer. We are not making our country healthier. And that's, again, this is just my opinion, layman in middle America, but I'm making this decision. I was in the military, and the military should be nothing more than a force for protecting our country and protecting our citizens. And it does nothing to make us safer by mandating that people who are all rights in the best shape of almost anybody in the country. So give me your thoughts on that, Francis, if you would.
Well, I'll talk about healthcare because that's more what I know about. As the NIH director for those 12 years, I also oversaw the world's largest research hospital on the campus in Bethesda, Maryland. People who come to that research hospital are people who've basically run out of options for standard medicine. Many of them have cancer. They may have an immune disease. Many of them are children. They are really sick and they're really vulnerable. And passing virus, even something not as bad as SARS-CoV-2, could basically spell the end of their opportunity to stay alive. So we had the same issue. I have 46,000 people that worked for me at NIH, and some 4,000 of them were in this hospital where they could have direct patient interaction. And this was at a point where we basically had to decide, was it okay for somebody who was unvaccinated and therefore could very well be carrying this virus readily and passing it on to be working with patients. And I just couldn't see that that was legitimate or justifiable. So we required it for healthcare providers in order to protect those vulnerable kids and adults who were probably about the most likely to die of anybody you could think of if they got COVID. And I felt that was the right thing to do. And there were a few people who refused and had to be reassigned to other places where they didn't have patient care. It just didn't seem ethical to allow that kind of risk to happen. And I think that's the dilemma that a lot of hospital executive directors were faced with. Could they actually justify putting patients at risk? They come to hospitals in vulnerable places and hospitals promise to take care of them. And then what? They're going to get infected by somebody who's carrying the virus who didn't get vaccinated. It just didn't seem right. So I will defend that. The military, I know less about.
Yeah, no, and that's fair. That's absolutely fair. And that's a great answer. And I appreciate now that we know that the virus or the vaccine does not completely prevent or prevent. I don't know. I don't even know what the numbers are right now, but what we do know is that now that the vaccine does not prevent the spread of the virus, then may have been a different story. But now that the data has changed, would your decision be different now?
I don't think so. I mean, the data now, it's not as open and shut, black and white as we thought, where if you were vaccinated, you couldn't spread it to other people. We know you can, but your chance of getting infected is about 1/5 of somebody who's unvaccinated. So just statistically, you're reducing the risk to patients if all of your staff are vaccinated. I will say, and you mentioned masks earlier, if anything, this means that we need to be even more careful about having healthcare providers wearing masks when they're around vulnerable people. Masks are not 100% effective either, but they do reduce the likelihood of your spreading the virus to somebody else if you're currently infected. We have that data very compellingly, not to zero.
Yeah.
So everybody will point to an anecdote and say, see, it didn't work. Well, okay, let's be a little more sophisticated here. Almost nothing is 0 or 100%. Masks reduce the likelihood of you infecting somebody by about 80% if it's a good mask like an N95. And healthcare providers wear those. That's why, even if they're vaccinated, we want them to do so. Sure. But as I told you all this, I realized this is different than what I would have told you a year ago or a year and a half ago. It's another example about how the science of all this just keeps evolving. And, 6 months from now, I might look back at this and say, well, that was wrong because
Sure.
We'll learn something else pretty soon. We just got to get used to that and not blame the people who are changing the message because we think that they are somehow jerking us around. No, it's the way science works.
Sure. Yeah. And when you talk about the efficacy of masks and one of the things for me that obviously, well, there's a couple reasons and I'll kind of give you my backstory, Francis, on why my hesitation to masks and why, unless I absolutely have zero chance of doing something I need to do, unless I put a mask on, I won't wear a mask, period. But there's a couple things for me and I know this is not just me. This is things that I hear from a lot of other people and people in healthcare as well. Now, the N95 mask, yes, it is obviously, if used properly, I think that's what a lot of people fail to realize. If used properly, the N95 mask does maybe have that 80%. But when we say when used properly, that means you're not touching your face. You're not taking it off to speak more clearly. You're not taking it down to take a drink of your soda when you're in the same room with somebody else. You know, there's things that about that N95 mask that have to come along with it to be considered used properly, to properly vet the efficacy of that, or properly obtain that 80% efficacy, right?
Very true. Like, it's really got to cover your nose.
Right. It's got to cover your nose. And the reality is over the course of the past 2 years, I mean, you saw people wearing neck gaiters and handkerchiefs and this and that. And my son, before he could get on the bus to ride the bus to school, had to put this neck gaiter on up over, but he's, it was all for show. It was all stupid. It did nothing. And there's a lot of studies out there now, and some people can say they're anecdotal or whatever, but the reality is kids do not keep their hands off their face. They're taking it down during lunch. They're taking it down to talk to their friends. So the efficacy of masks in school, it certainly did not outweigh the damage that it did in the social environment for kids, and it really didn't do anything for kids because it was never used properly. And I think a lot of people look at that and they're like, yeah, these things aren't being used properly. We were told we could wear a dirty sock or a handkerchief or a paper towel with 2 rubber bands on it wrapped around our ears, and that was going to suffice. But so that part of it really bothers me. And then another thing was, I went to Walmart with my family one day, and we're walking in the door, and one lady's screaming at the other lady because this gal doesn't have a mask on and that lady does. And this lady's saying, you're killing me and my family because you're not wearing a mask, or, this or that. And then the one punches the other one, and now somebody's going to jail. And this is literally the kinds of thing that middle America was seeing. This gal is wearing literally like a paper thin handkerchief mask, thinking that she is doing something to prevent the spread of this virus, when in all actuality it was doing nothing, because it's not an N95 mask. She, and so now it turned into a fist fight with somebody else from her community. Or the nonsensical lanes, the arrows in the grocery store and stuff like that. And it just caused so many problems because of the fear mongering and the misinformation and it made it rough. It made it rough. It made the past couple of years very rough for a lot of people.
Oh, yeah.
And, these things that they thought were going to be anecdotes, these things that the media tried to push on us and politicians tried to push on us with the, whether it be the masks that weren't N95 masks, or being able to go into a restaurant and you had to wear a mask to your table, but as soon as you got to your table, you could take the mask off. Those things, just the absolute ridiculousness of those things. I mean, the efficacy of masks at that point go to zero.
Once they're taken off, they don't help you much. And that caused people to lose trust in the whole thing. And pretty soon it sort of extrapolated. If the masks don't make sense, well, why does this 6-foot distancing requirement make sense? And, maybe those vaccines aren't anything I'd want to do either. And maybe what they're telling me about treatments that I think might help is not a lie. It is a lie too. I mean, it just all sort of started spreading. And there were too many recommendations that people couldn't see the logic for, and the trust began to deteriorate. And a lot of people enjoyed seeing that and whipped into it.
Well, a lot of people have capitalized on that distrust and that hate. And, that's one of the big things that I am trying to do with this podcast. Not only my time with Braver Angels, not only my time with you and our Truth and Trust project, but it's to bring down the level of hate and just the level of just terrible discourse that we found ourselves in this country. And that's why doing projects like this have meant so much to me, and doing things like this. You and I have, like I said, we've developed a bond, we've developed a relationship and a friendship that I'm cherishing every time we get an opportunity to speak.
Me too.
I look forward to so much more of it. But let's talk real quick before we kind of round this out for the day. What have you learned so far, Francis? And what have you taken away from our project as a whole so far? I mean, we're only partway into this.
Mm-hmm.
I know our goal overall between you and I is to build back and try to build back that foundation of trust between the average American citizen and the public health apparatus, and how that works in that relationship. What have you taken away from our Truth and Trust project here with Braver Angels up to this point?
I've learned an incredible amount, and it's just what I had hoped for. Coming into this, I don't think I had really a full understanding of truth and trust and where that comes from. I was kind of the mindset that, you just put facts in front of people and then they all make a rational decision and that's the end of it. And I misunderstood that we are not always rational creatures. I'm not either. We all sort of come into a situation with a certain view about what things are really important to us. And if information comes to you that resonates with that, you're like, okay, I'll bring that on board. And if something comes at you that actually threatens something pretty significant to your belief system, and what you and I have been talking about, this visual web of beliefs, something in the middle of your web, you're going to be not so comfortable accepting that, and you're going to question whether you should trust that person. So we are not fully able to be objective about information. And that really makes a big difference, because that says it's not just about what's truth, but who do you trust and where are you starting in terms of what you consider be your framework of beliefs. And talking with you and talking with a bunch of other people that Braver Angels have put us together with, I've increasingly begun to appreciate that my perspective is also biased by the kind of a community that I'm part of scientists and physicians and public health people, and by my own background of what kind of journey I have traveled. Certainly a big part of that for me and for you is being a Christian, a follower of Jesus. And yet I can see that has, all of those experiences have kind of put me in a place that's different than a lot of the people that I thought I could understand, but now I understand them better by listening. So that was a big part of it, is stop talking and start listening and really hear from the heart, what has somebody's experience been? And I can tell from talking to you and lots of other people, this has been a horrible 2.5 years of COVID-19 for most people in our country. And that all the things that were done, I think with good intentions by public health experts, have not really incorporated that insight from the people in the real world about what they were living with and what those recommendations were going to do that might not make it better, might make it worse. You and I talked with Matt Willis, who's a public health officer in California, and who had really worked hard in his job to develop a community panel to get insight and input before he made decisions about what to do about schools and masks and vaccines. I wish we'd done more of that, because I got to forgive the public health system a little bit, because it was a crisis and it was like you didn't have 3 months to convene a whole bunch of groups and try to distill through, but we could have done a bit more. And so I really have learned from that what that view is. The other thing I've learned, Will, is that when you have those conversations, it starts out a little intense at first because everybody feels like they got to tell you what's happened to them. Me too. And then Braver Angels has this way, after you've got that on the table, to say, okay, let's hear from each of you. What mistakes did you make?
Yeah.
And like, okay, I got to answer that. And all of a sudden, things really start to change, because then we all become human. We're not on a soapbox anymore. We're expressing our own self-doubt and our own humility. I mean, even the most confident person in the face of this crisis has to admit they've screwed up and numerous ways.
Absolutely.
And then we really start to understand each other. We start to care for each other. And I guess the other thing I've learned is at the end of those conversations, we all begin to realize that there is a fundamental set of values that have not changed and that we all still embrace passionately. Things like freedom, like family, like faith, like those wonderful features of goodness and truth and beauty. I haven't met too many people going, I don't care about those.
Right. Yeah, that's not important. Geez, I don't know what he's talking about.
That's down there. That's our foundation. Now, those pillars that my granddaughter did a little artwork to try to display that you have seen, those are the pillars. But then we have our web of beliefs that's kind of attached up above that reflects our experiences. And those can be quite different. And so we might feel like, well, I can't possibly ever understand what that person's doing. Get down to the pillars. And then all of a sudden, like, oh, we're not that different after all. That's what I've learned from Braver Angels. That's what I hope somehow, Wilk, you and I and all the other people working on this can figure out how to share, how to scale up to our hurting, divisive nation in pain, where we've really gone off to our separate corners, into our separate tribes, and have figured out that we aren't going to be safe if we actually interact with those other people who aren't just misguided. They're actually dangerous. And we got to get over that and figure out how to have those conversations again.
No, you're absolutely right. That tribalism, and you said so many great things there, Francis, but we didn't get a whole lot of time to talk about our web of beliefs and our pillars of our humanity and our pillars of our values, rather. And that artwork that your granddaughter did for that was absolutely awesome. And that exercise that we did together was awesome. And I think we should definitely talk about that probably in another episode of the Derate the Hate podcast, because I think it's very, very important. But a couple of things that you said there was talking about the humanity and really getting into the conversation, and then talking about the mistakes that each of us have made, whether it be our one-on-one conversations that you and I have had, or the conversations where we got together with a group of evangelicals, or a group of healthcare workers, or a group of everyday Americans, and just got past that initial wall, that initial, we're coming in here ready to fight. But you get past that, and then the air kind of comes out. That wall isn't so much a wall, but maybe an air mattress that stood in between us. It kind of starts to deflate, and we really start to see the humanity in each one of us. And you're right, that tribalism, I think that's so important. You talk about our going to our separate corners, and the tribalism that has come along with not just the pandemic. Let's face it, this has started a long time ago, a long time before the pandemic started. I think the pandemic just exacerbated a lot of it. And that tribalism has people just, it's almost like the Hatfields and McCoys. They don't even remember why they're fighting anymore. But if you hold this position, I'm going to hold that position simply because you're a Hatfield and you're a McCoy. We've got to be opposed to each other. Yep. And I think talking about scaling this up and the project that you and I are involved in, and trying to show people that just because we have these diametrically opposed positions on the government's the government's response to the pandemic, doesn't mean we can't see the humanity in each other's positions. I mean, looking at the conversations that you and I have had, and just kind of revisiting those, and learning about, how you grew up, and your parents, and the things that your parents used to do with you and your brothers, and just the getting to know one another. We get past that tribalism, that wall that stands between us, understanding that those pillars, those values that we share, and our web of beliefs are not going to be completely simpatico. They aren't going to match, because no two spider webs are exactly the same. No two web of beliefs are going to be exactly the same. But that does not mean that both of those webs aren't strong and meaningful and important. And I think scaling that and doing that and trying to rebuild that foundation of trust is such important work. And I'm incredibly honored to be be part of it with you for sure.
And I'm honored to do it with you, Wilk. This is important work. It gives me hope, and hope's an awfully important thing for us all to hang on at a pretty troubled time for our planet.
There you have it, my friends. That will wrap up the first public one-on-one conversation between Dr. Francis Collins and myself, part of the Truth and Trust Project started by my great friends over there at Braver Angels. If you want to find out more about Braver Angels, check out their website, braverangels.org, and see all the incredible stuff that they're doing to depolarize a polarized nation, to bridge the divide between people of differing opinions, and to put the unity back in our community. There's so many great things going on at Braver Angels. Check it out, braverangels.org. And while you're there, you may as well join up. Join as a member. I think it's only like $12 a year. And you can be part of all the great things they've got going on too. Friends, if there's anything in this episode that provided exceptional value to you, please make sure to hit that share button. Share it with your friends, share it far and wide. And of course, if you haven't done so already, be sure to subscribe right from our website so you can get the Derate the Hate podcast sent to your email inbox every week. So this is Wilk wrapping up for the week saying get out there, be kind to one another, be grateful for everything that you've got, and remember it's up to you to make each and every day the day that you want it to be. If there is something that you would like to share with me, you can catch me on most social media platforms, or you can email me directly, wilk@wilksworld.com. With that, my friends, I am going to back on out of here, and we will catch you next week. Take care.